United Healthcare Coalition of Texans with Disabilities, Raise Your Voice 2020 Advocate Connection Program, August 26, 2020, Community Attendance.
My name's Marjorie Costello. I'm with CDS in Texas. I'm a white woman with blonde hair, and behind me is a really old wood wall from 1910, and on it is a painting of a seashell, and it happens to be my dining room. So I'm really excited to be here and express our support for all of you in the coalition and involved in it. Advocacy is near and dear to my heart. It's a big part of what I do. And especially on the side of attendant wages, which is what this roundtable is focused on. That in itself is one of the most important issues, I believe, for people with disabilities in home care right now. The fact that we don't have a living wage for our personal care attendants is a travesty. And I have been advocating for that for about 15 years now with minimal success. And I really hope that in light of this recent pandemic, that the legislature will finally listen to all of your voices and recognize how important it is to be able to stay safe at home, and that personal care attendants are a big part of that, and being able to hire them and pay them a living wage is 100% necessary for that to happen. So again, I just want to thank all of you guys for wanting your voices heard and making them heard, and we continue to just support all of you in doing that. It's so important from every level of advocacy, grassroots to, you know, shaking hands with your actual legislature. So thanks, guys. That's all.
Hello, my name is Jolene Foster. I'm the Advocacy Director at the Coalition of Texans with Disabilities. I am a white male with dark rimmed glasses and long brown hair pulled up on top of my head. In the background, you'll see lots of things I picked up antiquing and numerous works of my children's art. I'm just going to talk a little bit about what CTD is for some of those of you who may not be familiar. The Coalition of Texans with Disabilities, or CTD as many people refer to us, was established around 1978. We're a cross-disability organization, which means that we touch on all issues, all disabilities across all settings, across the lifespan. So for example, today we're going to be talking about community attendant wages. We'll also be talking about other issues in subsequent sessions through this series. Our focus is advocacy, and we're among the primary disability advocacy groups that are driving policy change in Texas today. Two of our core principles in advocacy is always to involve you, those with lived experience, those who care for loved ones, those who navigate the services and supports, the day-to-day challenges as well as the successes. We value you as self-advocates. We value community input, and we will always put your input first. So what is Raise Your Voice? The idea of Raise Your Voice is to offer an opportunity for us to hear from you and to kind of share some of the things that we're working on moving forward so that we can move forward together. And when we say raise your voice, we really do mean that. We really want to hear your voice. Today, as I mentioned, we're going to be talking about community attendant wages, and over the next series of Wednesdays at 2 p.m. we'll be highlighting some other targeted issues. So for instance, on September 2nd, we will be discussing voting for people with disabilities. The following Wednesday on the 9th, we'll talk about the dental benefit for adults on Medicaid. And we're going to take the 16th off to recognize the civil rights holiday for our Latinx community. And then we'll resume on September 21st and talk about expansion of medical cannabis. So what you can expect today and moving forward, or if you've participated in previous sessions that we've had, is that first of all, we will value you, we'll listen to you, we'll involve you. We will share information with you on advocacy issues, on developments, strategies, the process of legislation, as well as opportunities and more. You'll have an opportunity to connect with other self-advocates, family members, interested community members. Some you may know, some may be new. They will be sharing their ideas, and you'll exchange your own experiences and ideas as well. So it's going to be very interactive. We have an experienced staff in advocacy, and we'll be here to collaborate with you and to support you in any way that we can. Finally, what we're going to be doing during the 2021 session, that's a great question, right? So in preparation for 2021, we don't really have an answer to that. We don't have a clear description of what the legislative session will look like, whether there will be in-person hearings, whether we'll have to schedule meetings, whether they'll do things virtually. We're still trying to figure all of that out. But CTD, what we do know is that CTD is going to continue to keep you informed on whatever those developments are, whatever guidance is delivered, and we'll make adjustments with you to make sure that we can ensure that you have an opportunity to raise your voice. So I guess at this point, let's dig into some issues, and I'm going to kick it back over to Dennis.
Thanks, Jolene. If we're ready to share the results of the poll, are we? You're going to nod your head at me, Laura, and we'll take a look at it. Wow. The overwhelming response, by the way, there's none of them are low. Every single one of these issues had a significant level of concern for all of you. But the low wage, can't keep attendance to the low wage, it was 100%. That's amazing. Not surprising, but I think it points to the value of our conversation today. And the next highest one was difficult to recruit. Again, recruitment and retention, the big issues. No benefits was the next highest one. High attendant turnover, which of course is a result of those previous three of a low wage, difficult to recruit, no benefits. Potential loss of independence to live in my own home. Oh my gosh, cited by 68% of respondents. That's scary. Fear of institutionalization, 52%. And creates hardship for my family and friends, 56%. And here's a telling thing, is nobody answered none. That means these items we looked at are in fact all things you're concerned about, and I'm very, very impressed. So thank you for that poll. We will keep the results of that poll, and it's going to inform some of our advocacy going forward. At this time, I'm going to introduce a top-notch advocate for the issue of attendant care, provider care in the state of Texas and beyond. And I'm talking about Cathy Cranston, who is the founder of PACT, the Personal Assistant Coalition of Texas. She's going to correct me if I got the A wrong. And then, of course, a longtime member of ADAPT. And I can tell you, I have been shoulder to shoulder with Cathy on so many occasions. I can't count them. And she is quite the expert. Cathy, I'm going to kick it to you, please.
Oh, thank you so much, Dennis. I'm Cathy Cranston, and I am Mexicana and brown skin. I'm wearing a yellow t-shirt. I go by the pronouns of she and her. And in the background, there's a sign that says Fun, Hope, and Community Services. And part of Home and Community Services is attendance. I am part of PACT, Personal Attendant Coalition of Texas. We're a grassroots coalition that consists of personal care attendants, direct support professionals, people with disabilities, and other supporters. Anybody that is advocating for higher wages, health insurance, paid vacation, and time off. And I am I don't know if they've left yet, but I'm wearing a mask, and so it's hard for me to talk and breathe through this mask. I will take it off when our visitor leaves the house, though. But so there's approximately 275,000 personal care attendants that work in Texas under Medicaid. And PACT was formed in 2005, and we are the voice of our attendants that work for us and direct support professionals. And part of that creation was so that there would be an entity that's solely focused on the issue of attendance. Attendance meaning livable wages, health insurance, paid vacation, and time off. And so we created it. And also, I just have to say kudos to CTD, the ARC of Texas, many other organizations that, and as well as, I will say Meals on Wheels is present, so thank you for being here. Family Elder Care, I believe, is present also. And each of these organizations have advocated in the past for increased wages for our personal care attendants. On a personal note, I've been working as a personal care attendant out in the community for about 40 years. And so the face of personal care attendants, direct support professionals, is predominantly women. We're women of color. We're 48 years of age and older. We also, many of us live on federal assistance also because our wages are so low. Let's see what else. Also, I want to go into a little bit about the history of our wages. Let me just check and see if Amy has left. I think she has. Did anybody see if Ron went out the door? No. Yes. Okay. Good. Sorry, guys. And so I was practicing social distancing and safety, and that's one of the issues that we all are trying to do, stay healthy. And so in the history of this advocacy that we've done, oh my gosh, for even before 2005, but there have been so many sessions. I know in 2006, we had worked with the Health and Human Services Commission to try to start increasing those wages. They knew, the state has known that they basically have dropped the ball. They won't acknowledge it and admit it, but they have. They've dropped the ball since then, because even then it was difficult to find attendants, but it's even more so now. And so in 2006, we were working with HHSC to create, and I'm sorry, I wanted to send this to you guys, but we'll send it later. And what it is it's part of a home and community-based service workforce advisory council that was formed in 2010 under Executive Commissioner Cease, who was the executive commissioner at that time. And what we ended up doing was creating recommendations to our state legislators, saying this is what we need. And of course, one of the very top recommendation was increased wages, as well as many other recommendations, but that was one of the very top ones. And so what this appendix did was it compared the different wages across the spectrum, you know, regardless of who you worked for. It covered all the different programs, and what it also showed was the wage disparity depending upon where you were receiving your services, whether you worked with somebody with an intellectual developmental disability or somebody that was aging or with a physical disability, you could see a wage disparity. And part of that has just been created federally, actually. But getting back just to the history of the fact that our wages were so low. Back then, the wages were, I think, about 7.25. And so, you know, there was a big push by PACT, Adaptive Texas, CTD, all of these different organizations working in concert to increase the wage. I think it took a couple of sessions before we were able to increase it from $7.25 to $8 an hour as a base wage. And Dennis or Nancy, you can chime in if you know the years. It's just kind of not in my head right now as far as the years. And so we got it up to 8 after a couple of sessions, a couple of bienniums, and then not last session, maybe 2 sessions ago, we were able to get it to $8.11. Yay! Right? I know I'm preaching to the choir. It's so frustrating, guys. I know it's for all of us because all of us have been there advocating, making our visits to the legislators, you know, telling them what we need. And it's just very frustrating. But with that, one of the things that we have looked at also, because we need to keep pushing this issue, and I'm preaching to the choir again, we've got to keep telling the decision makers like Sarah Davis, who oversees Article 2 in the Health and Youth and Services Subcommittee, committee, and she's the chair. And so that's the person, the point person that we're going to ultimately need to send our emails, call her office, leave a message, telling her we need you to increase those wages under our interim charge, number one. But one of the alternative things that I think we could also put into that is under the recruitment and retention piece, because what we're finding, you know, working with Adaptive Texas too, and under PACT, we get calls, and I go in once a week to the office, and we're still getting calls from people out in the community looking for attendants because they can't find attendants. You know, their attendant either got sick or, and under the pandemic, people are refusing, unfortunately. Attendants are human too, and they're afraid to go to work, or they don't have, early on in the pandemic, they may not have had somebody to take care of their children. And so they couldn't leave them at home, you know, because they're young. And so they wouldn't go to work. And so that would leave who? The person with the disability and alert, you know? And so with that, things that we are looking at too, is creating alternatives such as internships for nurses and social workers. And in fact, nationally, there's a pilot that, and I can't remember what state, but I know Centene has created a pilot where and I believe it's Centene, where the OTs and PT, people that are off, that aren't working right now, are indeed filling those slots as personal care attendants. And so this is good because we need attendants, right? The other ideas that we have are hiring seniors. My husband was able to glean an attendant from a program that the city ran. This was probably 15 years ago, but it's a great program where they hire seniors. They find jobs for seniors, seniors that maybe have a retirement and don't necessarily need that extra money. And I'm not saying don't pay them fairly. I want them obviously to be paid their service, but at the same time, I know as not just as a worker, as an attendant, but also as an advocate for an individual with disabilities, we've got to find attendants. And the other thing is training individuals with disabilities to work as attendants. I know UT has a program which is really cool, E for Texas. And so these are programs that, you know, we've been pushing and supporting. And so I think it's good to plant those seeds into our legislators' minds. There was one other thing I wanted to mention, but I guess I don't remember it. So go ahead, Dennis, and I'll jump in if it comes back. So
please do. So I think the clear takeaway you get from Cathy is this really is a money issue. This is really about pay. And you've all heard the statement, you get what you pay for. Well, it was bad when Cathy first became active, and I first became active, when I first became active, it was almost 20 years ago, and I think Cathy more so. And it hasn't gotten any better. So what's happened now is it's I call it the perfect storm. And one of the perfect storms is if you look at the wages as they existed in the start of community care and where they are now, and you adjust them for inflation, the wages have actually gone down. They've eroded by about 30%, in fact, more than 30%, okay? So we've actually devalued these attendants. And meanwhile, our state is getting bigger as far as population. And we know that, for example, the older population is going to increase by 90% by 2030. Those are high users of attendant care. We also know that people with disabilities younger than the older adults are also increasing. So we have a diminishing wage scale and increasing population. And I don't know if Laura, if you can pop up that one screen share. Yeah, this one here, this is a study that was produced by the Texas Workforce Commission. As you can see, I'll read you the title, Texas's Fastest Growing Occupations. Now, the two that are in bold, number 1 and number 3, they're the same job. That is what sometimes the provider, sometimes the caregiver, sometimes the personal assistant, sometimes the attendant. But, the personal care aide and the home health aide is the same job. Now, so basically think of them as the same job. So the change, as you can see, is they're expecting, if you add those two numbers together, the 76,000 new jobs needed, plus line 3, new jobs needed of 25,000. That's in excess of 100,000 new attendants that we're going to need by 2024. Wow. Okay, and we already can't fill the jobs we have now. Now, to give you an idea of how bad this is in the larger view of economics, if you took all those other high growth occupations, and added them all together, the attendant care, the need for attendants is higher than the next 8 highest growth occupations combined. Get that? I'll repeat that. Higher than the next 8 highest growth occupations combined. All right, you can take that down, Laura. So what we have is a situation with diminishing wages, increase in demand, recognized by the Texas Workforce Commission. But we also know the Texas Workforce Commission won't do anything about it. Now, why not? Because under federal law, and they get some federal assistance at the Texas Workforce Commission, they can only help people get jobs that pay basically a subsistence wage, which you don't get as an attendant. So they're not even going to help recruit people. So the state's main workforce recruitment agency is powerless to help in this situation. Meanwhile, alternative employment, like the fast food industry, like the taco place around the corner from me, which is advertising $15 an hour. The chicken place by CTD starts at $15. Buc-ee's, the service station, convenience store, starts higher and gives benefits. It used to be that those jobs were fairly close to the bad wages of attendant care. Not anymore, because they respond to market forces. So why doesn't the attendant wage respond to market forces? Because it is set by the legislature, and they ignore that. Cathy mentioned COVID is actually making this situation worse, but one thing that COVID should have taught everyone, much better, for an individual with a disability or an older adult to be supported to stay in their own home rather than in a nursing home or be forced to go to a hospital or other congregate setting. So this is an action today. What we're talking about is doing action. So Cathy referenced the Appropriations Committee. They are taking input right now on the attendant care. We've sent all of you a one-page sheet on how you can send an email in, tell your story, or raise your voice any way you want. And Marjorie, I would hope you would do that from the point of view of an agency trying to hire people to do this work. So in this document that we've sent you, and we will send it again, okay? It has the email, the due date is the end of September. It will go to Chair Sarah Davis, who's the chair of the Health and Human Services Appropriations Subcommittee. Powerful person. We want her to hear a lot of these. And believe it or not, if every one of you, and I'm looking, there's above 30 people here on this, if every one of you sends it in, that'll seem like an avalanche because most people don't bother contacting the legislators at all. And we're going to keep doing this as we go along. So before we do a little bit of work, I want to answer a question that no one has asked but is thinking. And that question is, I'm hearing the lieutenant governor and the governor and all this talk about how they're going to be broke next session. Well, I will tell you, don't buy it. Number one, as advocates for people with disabilities, we're going to advocate. That's our job. And number two, the state has a gigantic rainy day fund. It's received billions of extra federal dollars that they haven't spent. They'll probably get more. They can do things to shut down some loopholes that have existed for sometimes decades for certain industries that don't need it anymore. And they can create new revenue streams like Medicaid expansion, for example, expansion of medical cannabis, and other issues that, so don't believe it if they tell you they're going to be broke. The important question is, are they going to serve the needs of the citizens of Texas? That is an important question. So our task. So the first thing we're going to do is we're going to ask you to think for a few minutes. Think for a few minutes. And what would you say in your email? Now your email can be long, it can be short, it can be a few sentences. I'm afraid I'm going to be in a nursing home because I can't find anybody to work for $8.11 an hour. That's persuasive. Or it could be longer. I've had years of trying to fight this. So we're going to give you a few minutes to do some thinking. You can maybe make some notes if you got something to write with, or think about in your heads what you will say to Chair Sarah Davis.
After drafting comments,
Thank you all for taking a few minutes and to talk privately. I know that Juan and I enjoyed the conversation. Martha was able to listen in. So we have sent you a little document here about this communication. Please don't blow us off. Do this. You can send an email. If you're from, more organizations, distribute this to the people that you're connected to. We will. If, like I said earlier, if all of the 30, 35 people on this Zoom call did this email, that alone will get their attention. Now we can amplify that by getting more people. I see my friend Marsha Weir is on here. I'm hoping that all your attendants will get to look at this too. And what we've got down is one page, and it says, take action. So what, the chair is requesting this information, your input. And what they want to do is respond to what they did in 2019, which is an 11-cent raise, right? That's what Cathy told us, and she was right, 11 cents an hour raise. Since 2013, the total raise has been 25 cents, including that 11. That isn't going to cut it. So what they say, when you do your email, you can do it as a Microsoft Word document, a Word document, and it can't be more than 5 pages. Now, it doesn't mean you have to do the full 5 pages. Some of you might, I might, because I'll throw some graphs and stuff in there. But you can just tell a personal story. I see my friend Nancy Crowther there. I've had her tell me about how difficult it was to recruit an attendant. Because I believe she lives out in Bastrop or something like that. It's kind of hard to get to. And, that's a great personal story. Maybe if they're paid $15 an hour, and that's our goal. That's what we're asking, $15 an hour base wage. which is not too much to ask. People say it's too much to ask. Say, well, I can make a chicken sandwich and make that much money, because it's true. Okay, no more than 5 pages, can be short, and there's an email address that's in this document. Again, we will resend the document to all of you, okay? And it describes, you have to put ART2, that stands for Article 2, in the subject matter of the email. And then in the email, you'll say your name, if you're part of an organization, or just your personal self, your mailing address, your email. You put that in the email. You put that in the email. Okay, so the attachment is your document where you're making your statement. And in that, you don't put in your email address or phone number in that, because that will be shared with everybody. What you write is going to get shared on the state of Texas multiple websites. So think how cool is that? You know, tell that the Nancy story. Yeah, it took me 3 months to, find an attendant and to recruit an attendant. And then the turnover, they left in 2 months after that. Those kinds of things will be shared by all the members and to all the members of the committee and the public. You have until September 30th, but we're asking you to do that this week. Can you do that? Can you take an email, shoot an email this week? Again, you'll get this instruction and it'll walk through it. And if you have any questions, contact us. Contact CTD or contact Cathy Cranston at ADAPT and PACT. And let's, you know what? Let's not take this lying down. They've treated people with disabilities poorly and the people who care for them poorly for a very long time. And you know what? Maybe this COVID crisis wouldn't have been so bad if they had those jobs filled reliably for people. In fact, I venture to say I know that to be true. Okay, so we're doing this in our whole series of these that, it's all free to anyone who wants to participate. But of course it's not, it does cost us money and staff time and Zoom subscriptions to do all this kind of stuff. And the reason we're able to do it is some sponsors have stepped up and said they're going to cover the costs. And those are at our entry-level care source, Shield Healthcare, MCNA, which is a dental managed care organization. On the gold level, DentaQuest Partnership, AstraZeneca, Amgen, all, nice support there, and Amerigroup. On the diamond level, CDS in Texas. Thank you, CDS in Texas, for your introduction today. Pharma, Superior Health Plan, and our highest level sponsors for our Raise Your Voice program this year are Hart, InterCivic, and United Healthcare. And you know what? We couldn't do this without those guys. So tip of a hat to them for funding this activity. And we will be doing more starting next week. What's the subject next week, Laura? Is it voting?
I don't know.
I think it is. I think it's voting rights next week, and voting rights and disability rights. And I know that, by the way, Chase Bearden will be leading that, who's our voting guy. So is there anything else I need to do, Laura, or I would just thank everybody? I want to thank you, Cathy, for coming. Thank you, Marjorie, for your opening comments. Ted, I'll be back in touch with you. I see so many old friends here, and thank you, Jennifer, Jolene, Juan, and Laura, for all your work making this happen. Take care, send those emails, and we will be back next week, and we're going to be back throughout the fall doing this kind of work. And the more you can help us get this thing done, the more we can get it done. Because you know what? It's not an option to keep going forth at $8.11 an hour base wage, because that will collapse the workforce. Then people end up in hospitals and nursing homes. And then the legislators be crying about how expensive Medicaid is when they caused it to collapse. Mm-hmm. That's part of my message to them. Take care, stay healthy, and see you next week, I hope. Bye.
Thank you, guys.